Hello everybody. We are getting a very late start today, but go ahead and come on in and let us know that you're here and you're hanging out with us, and let us know what school that you're coming from, and we're going to get started in just a second once we get a couple people in here, once people see that we are going live. So come on in. I'm going to let this wait for just a few minutes while people are coming in. So I'm videoing by myself today, and so it's going to be a little exciting. We'll see how it works. So if you guys have questions, please feel free to ask them. There is a delay, and I'm going to be up here teaching and kind of running around and grabbing some things, and we're going to do, I got some props and things like that. So I'll just kind of be running around doing things. So I'll try to answer your questions as easy as I can. And please do remember there is a lag, so whenever you ask some questions, there's going to be a little bit of a delay. But today we are talking about infection, and we're doing some safety things, and we're mainly going to be talking about what I have up on the board today, which is trying to remember contact, droplet, and airborne precautions. This is our big lesson for today. A lot of students have a hard time remembering what goes with what, and which one fits into where, and what you're required to wear. So that's that's the main focus for today. A couple of announcements before we get started, and while people are kind of coming in, and I'm going to kind of see who's coming in. Like I said, I'm going to be walking around a little bit here and there. And so we have some upcoming Facebook Live things coming up, and we've been doing those, and they've been working out really beautifully. So we have an EKG mastery session that's coming up. That's a Facebook Live. We have a cardiovascular review coming up. So I would encourage you guys to check out our events tab on the Facebook page and see what we have coming up. The Facebook Lives are fun. They're just like this, except for they're a little bit more intensive. They're a little longer. And so how those Facebook Live sessions work is those are paid. They're $25, and they're 1 hour sessions, sometimes a little longer because I get really excited about teaching something. And anyhow, so once you register on our booking site, you're entered into our private Facebook group. In that private Facebook group, we will live stream the video on whatever the content is that week, whether it be cardiovascular, cirrhosis, hepatitis, whatever that looks like. After we live stream, it will be downloaded onto the site. So if you can't make it on that date or time, that's right. We will have it available for you on the page, and you'll be able to view it for 2 weeks. So you're going to be a member of that group for 2 weeks, and you can watch the video as many times as you need to. After we download the video onto the site, we will either post worksheets or practice questions depending on what the content is, so that you can practice what you learned, and we can make sure that you understand what you've learned. We do giveaways and prizes for people that get answers right, so it's a really fun exercise. It's a really fun thing to do. They're very price effective. We have something for every budget, so those are really fun. You can find all of the topics that we're going to do, and every week we do a body system. So 1 week we do hepatic. 1 week we do the respiratory system, 1 week we do cardiovascular, and so we kind of go over all the biggest concepts you need to know for that system. So you can find all of those on our Facebook page. There's a big thing, a big picture that will tell you exactly what we have covered, or you can go into our booking site, and I'm going to post a link for that. And they're called Facebook Live Learn All the Things seminars. That's where you can find those. So we have a bunch of those coming up for in the next couple of weeks. So I wanted to let you guys know that so that you can register if you're interested in doing those, because they're super fun, and they're quick and they're easy, and you learn so much in such a short period of time. We are going to open up the ABG session again. We did that one last semester, and it was a huge hit, and it was really helpful. So we're going to go ahead and open up ABGs live again too, so if anybody's looking for those. Let us know what other topics that you want. So if there are topics that you're interested in, pop on in and let us know, hey, I don't get psych, or hey, I don't get, testing for OB patients. I don't understand that. So let us know what you want, and we can add some additional seminars on there too. We're also doing Facebook on-demand sessions, so if you have some people from your class that have a big test coming up and you want to do a group session with me or any of our other expert tutors here, then you will just call our office. You have to have at least 7 people to do it, and we will live stream for either 1 or 2 hours. We can either do Skype so we can hear back from you, or we'll do a Facebook Live session where it's just like this and we're streaming to you. You'll send us your class information, whatever it is that you want to cover for that. We're going to be, we have a storm here right now, just want to let you guys know. So the connection is not super great. So if it pauses, just give it a few minutes. It will end up reconnecting. So it's just, you can hear it's thundering and lightning, and it's kind of scary here. And after we had a giant hurricane, that doesn't feel that great. So We are doing a t-shirt giveaway today. So we have these cute little Ivy League tutoring t-shirts, and so anybody that participates in the session today will be entered to win a free t-shirt. We'll ship anywhere, so you don't have to be local or pick it up. We will ship to you, okay? So we're doing that today too. So we have a lot of really fun, cool stuff coming up for you guys, okay? So come on into the session. If it does freeze, just get out of the session, come right back in, and it should pick up for you. Okay, we're going to try the live again. I'm going to connect to different Wi-Fi. It is storming pretty terribly here, so y'all bear with me while we get the live video started. You guys go ahead and come on in. Let us know where you're from. As soon as a couple people get in here, we're going to go ahead and get started before we lose connection again or get swept away in the hurricane. Okay, so the weather is looking pretty scary outside, but we're going to keep moving forward for as long as the video will allow us to do that. Okay, so you guys come on in. Sorry about the connection. We will get it fixed. Or, you know, the storm will just continue to scare us all right? So, as you guys are coming in, will you please let me know where you're from, what nursing school that you're from, and kind of what you are interested really in looking for today. This is the board I'm going to be up on for most of today. I did some mnemonics for you guys, so we're going to be doing infection, and mostly what I want to cover today is how to remember contact versus droplet versus airborne. So we've got some mnemonics to help you do that. What you're going to see up here before I get started, anything that's in this kind of reddish or rust color here is what you will find in these precautions. So these are kind of your keywords to sort of help you remember what's included in each of these, all right? The ones that I'm going to write in green down here are going to be exceptions to the rule. So of course in nursing school there's never anything that's black and white. There's always going to be an exception to the rule. So anything that I write in green here is going to be an exception to this rule. And I'm going to go over that a couple times until you kind of learn it. Once you learn this is going to be incredibly valuable. It's super easy to remember. You won't forget your conditions in here. All right. So we're going to go ahead and get started. Okay. All right. We've got, I see Nicole's in here. We know Nicole. Nicole's an Ivy League student, and she comes here. So we got Nicole, and Beatrice is here. Welcome from California. So I'm going to be answering your questions best we can, you guys. If you have any questions on what I'm going over, I want you to go ahead and just write your questions in. I'm doing the live video kind of by myself today. So I'm a one-woman show today. So we'll get to your questions as soon as we can. We will post a picture of the completed board once we're done. So this is going to be a work in progress. As we get finished with it, we're going to snap a picture and we're going to send it to you guys on the Facebook page so that you'll have the picture. You can try to follow along with us too. It helps if you write it on your own as well. If you write it, you hear it, you listen to it, you're doing all those things. All right, Rosie from Maryland's here. Thank you. I'm glad you love our sessions. And Nicole, we love you, girl. So I'm glad you're here. All right, so we're going to go ahead and get started. Okay. So we have 3 different precautions. All right. We're going to have contact, we have droplet, and we have airborne. These are the typical 3 that you're going to see when you're in the hospital. All right. So let's start with contact precautions. So contact precautions is something that we're going to do if there's just, this is really like the grodies, okay? I don't know if that's a word for you guys up north, but in the south, it's just things are grody, okay? So contact precautions are things that are just kind of grody. It's anything that you would find in a wound, in your gut, okay, or creepy crawlies on your skin, all right? Those are our 3 keywords for contact precautions. So I want you guys to, I wrote a mnemonic for this, all right? And the mnemonic, this is all going to be like superhero themed, okay? So the mnemonic for contact precautions is he is Superman. So seeing that he is Superman, there's going to be your mnemonic. So each one of these letters is going to correspond with a disease process, something that you would find in a wound, in your gut, or on your skin. So I want you guys to try to fill this out best you can with disease processes that you know go in contact precautions. All right, so I want y'all to give it a shot first, and then we're going to start writing them in. Okay? All right, as you guys come in, let us know where you're from. We see a couple of familiar people in here. We love having repeat students come on in, so y'all let us know where you're from. So do your best on contact precautions, so anything you'd find in wound, gut, and skin. There's an empty box on the other side too. And on this side here, you're going to put what is required PPE, okay? So what I absolutely have to wear, and that's what NCLEX and your nursing exams will typically test on, is what is required PPE. Now you can always add on PPE as necessary, okay? But this is what is absolutely required for these precautions, okay? All right, so you guys try to fill out he is Superman. And I'm coming in. Are y'all ready? Okay, so anything you find in wound, gut, skin is going to go in contact. So let's kind of start with the heat. So this is going to be here herpes. Now herpes, this would be something I would find on my skin herpes. So that would typically be like our shingles sort of things, all right? So any kind of herpetic skin infection, all right? Sometimes people will get these cold sores that can be herpetic. Anything that's on the skin that's herpetic or herpes is a skin, so that's going in contact, all right? Our E is enterovirus. Now enterovirus is a kind of virus that you will find in a couple different places in your body. This one specifically is enterovirus that you would find in the gut. So I'm going to put a gut next to here because this is everything you'd find in your gut, all right? The I is for impetigo, all right? So impetigo is those little sores, very common in peds. So you learn about PD questions on this. They're right here around the mouth. Usually they're honey crusted, erythematous base lesions. Kids scratch them, scratch other parts of their body and kind of spread it everywhere. Those usually inside those little lesions are staph or strep, but since it's something that's on the skin, it's considered in contact precautions, all right? Our S here is for scabies. So scabies are the little teeny tiny bugs that crawl up underneath your skin, okay? And so those go and they burrow in between your fingers and in between your toes. And they lay eggs, and that's what causes severe itching. So that's where you'll see the scabies is there, okay? All right, so far we have he is, now we're gonna do Superman, all right? So the S here, there's two of them, and both of them are found in your gut, all right? This is Salmonella, and this is Shigella. So both of those are yicky stomach bug kind of things that you can get either from bad food, bad water. It causes severe diarrhea, bloody diarrhea. It's pretty yicky, all right? So those are my two S's that are gonna go here, okay? It was so hard for me to find anything that started with a U. So just what I wrote here was ugly bugs, which is kind of silly. But any of these ugly, nasty little bugs that crawl up underneath skin, like bed bugs and things like that, are gonna go under contact precautions, all right? Our P is going to be pediculosis, okay? So pediculosis is our, does anybody know what pediculosis is? No, it is lice, okay? So that's gonna go there. And then the E is for E. coli. E. coli we find in our gut, okay? R stands for rotavirus. Rotavirus is also a gut bug. So anything we find in our gut is gonna go here. And then we're gonna do man. So the biggest one that people typically think of with contact precautions is MRSA, okay? So MRSA is gonna go there. And then A is adenovirus. Now adenovirus can go in a couple spots, but this will be adenovirus that we would find in the gut, okay? And then the N is norovirus, and we would also find that in the gut, okay? So he is Superman is going to be our contact precautions, anything you find in wound, gut, skin. There is one exception to this rule. It is something that you think that you would normally find in Droplet because it's respiratory. Does anybody know what the exception is where you would think it's a disease you would think would be respiratory, but you actually, it's in contact precautions? Does anybody know what that is? If you know it, I want you to say it. And there's a little delay, so I get that, okay? This one is tested on all the time. Okay, so you definitely want to know this one because it's a tricky one, okay? It's not TB. TB we're gonna find in Airborne. That's also an exception though, and we will come back to that. Okay. Anybody know what we would think would belong in Droplet because it's a respiratory condition, but it's actually contact? Anybody? It's usually a pediatric disease. I'm trying to give you some hints so you can come out with it. Anybody know? If not, I'll just go for it. All right. This one that goes right here is RSV, respiratory syncytial virus. All right, so RSV is typically, I mean, of course, it's a respiratory disease. It's a pediatric disease, so you would think that it would go down here. Any exceptions to my rules here are going to go in green. So where you would think, all right, contact is wound, gut, skin. Respiratory is RSV, but RSV is going to be an exception to the rule. So RSV is contact precautions. Y'all need to know that. I cannot tell you how many people have had that on their NCLEX. They have had it on exams. Like, it is a heavily testable thing because it's an exception to the rule. Okay? So RSV is actually contact precautions. All right? Now, what is my required PPE for contact? As far as CDC is concerned, you have to wear a gown and gloves. If you're within 3 feet of the patient and you're doing extensive patient care, those are the basics of what you need to wear. Now, you're going to use your common sense whenever you go into the rooms of patients, okay? Because if you are suctioning the trach of a patient that has MRSA, well, yes, according to CDC, you only have to wear a gown and gloves. But I don't know if you've ever suctioned a trach before. That stuff can squirt everywhere and go everywhere. So I'm going to probably be wearing some goggles and some kind of a mask so that I can protect myself, all right? I was clinical faculty at a university down here in Texas, and we had a young lady who knew that there was contact precautions in the room. Her patient had MRSA, but the patient had MRSA of the trach. And she went into suction. It was her first time. She was super excited and leaned over the patient. And when she leaned over the patient coughed, and that trach stuff went in her mouth. I am not kidding. It's not okay. All right? So protect yourself. So I'm not saying that you cannot wear extra PPE. If you need to wear extra PPE, if you're going to be, let's say, lancing an abscess, okay? I also learned that the hard way. I was a new nurse practitioner in pediatrics. I had just started doing primary care, and I was lancing this big giant abscess on this kid's leg. Well, I had my gown and my gloves on, and I'm doing my thing, and I'm feeling very nurse practitioner-ish. That's a word, you just don't know it yet. And so I'm doing it, and I'm lancing, and I'm lidocaine, and I'm like, this is so awesome. And I feel the teeniest bit of like, oh, like something dripped on me from above. Like nothing squirted in my eye, nothing exciting happened. Just a teeny little like, oh, that was weird. The next day I wake up, I have full-blown paraorbital cellulitis. My whole face is swollen. I had to go to the ER, get IV antibiotics. So this stuff does not play. So if there's anything in a wound, in your gut, on your skin, it doesn't play. Wear your stuff. Okay, wear your required things, but also take caution and think about the different kinds of ways that you need to protect yourself. Okay? All right. Oh, I see Wendy Brown joined. What's up, girl? We're glad you're here. All right. And Chelsea, I think we've had you in here from before, too. So, Chelsea, I'm glad you're here. All right. So, those are our contact precautions. All right. Let's do droplet next. All right. So, our droplet precautions, everybody knows, you kind of think of it as respiratory, right? These are respiratory conditions. So let me grab my marker real quick and let's go through these. So I want you guys to practice and to try first, okay? So the acronym for this is Spider-Man. So I want you guys to give it a shot and see how many diseases you can name for this acronym Spider-Man that belong in droplet. This is anything that's respiratory, okay? All right, so here we go. All right, so what do you guys got? All right, so I see some people coming through with meningitis, pertussis. Okay, so yep, keep going. We got a whole bunch of them to do. Fun fact too, the S here is gonna have a couple of different ones, and the P also has 2. Okay, the M has 3, so I'm gonna give you guys just a few minutes to try to fill that out best you can. you guys ready? Let's hit it. All right, so acronym here is Spider-Man. Okay, so the first S here, we actually have 3 S's. The first one is going to be strep throat, okay? So strep throat, this one's kind of weird and a little bit tricky, okay? Strep throat is included like in the throat area, so that's going to be something we would consider respiratory, all right? I'm going to come back to that in a second because this can get a little bit weird, so I'm going to come back to that. So strep throat is one. Then we also have sepsis, okay? So sepsis typically is going to be included in droplet, all right? So sepsis, when we get bacteremia, and then we get bacteria kind of everywhere. P is parvovirus B19. Does anybody know what the real name is for parvovirus B19? We, of course, are not going to call it that in clinic, okay? So does anybody know what parvovirus B19 is? Anybody? I'm going to let you guys kind of tell me and I will come back to that. All right, so the I is influenza. So influenza is, of course, flu. Okay, and that's a respiratory condition, so we would expect to see that. The D is diphtheria. Now, we hardly ever see diphtheria anymore, and the reason being we have a vaccine for it now. So we have the DTaP vaccine, which is why we no longer see it. Okay, so it is very uncommon for us to see that, but it is there. Okay, fun fact, not that fun, but a little fun. All right, so E is for epiglottitis. All right, I'm going to switch colors over here because we're losing the black marker. So epiglottitis is a inflammation of the epiglottis, which is that little flap that goes on top of your airway. So all of the throat and respiratory stuff are going to be considered in droplet. All right, so epiglottitis goes here. Now the R is going to be for rubella. And that's a disease that we see, like if we see that in pregnant people, we get super nervous about that. And so rubella is going to go in here too. Then we have M, and M actually has 3. We've got mumps, we've got meningitis, and we have mycoplasma, which is a kind of pneumonia. So it's a kind of bacteria that can cause a pneumonia, all respiratory, okay? So anytime you have a patient that is diagnosed with meningitis or even suspected meningitis, they love this exam question. Even suspected meningitis, all right, the first thing you need to do is to get that PPE on, and your PPE would be droplet, okay? The A here is for adenovirus, okay? Now we had adenovirus up here, but that was adenovirus of the gut. This would be adenovirus of the respiratory system, okay? And then the N is for norovirus, all right? Again, norovirus is a virus we can kind of get anywhere, but this one is going to be a respiratory, so you're going to see the cold signs and symptoms, okay? Norovirus is a virus we get, almost everybody ends up getting it somehow in the fall, and it has severe cold symptoms that can sometimes have GI symptoms too, where they get sort of like a stomach bug. So if it's the stomach bug-like part, then that would go under something in our gut. If it's the respiratory, the cold and the cough, all of that, we're going under respiratory, all right? So this is droplet. Droplet is mostly respiratory, throat, anything kind of here in the respiratory system. The acronym here is Spider-Man. So we've got strep throat and sepsis, parvovirus B19, which did anybody, I'm going to see if anybody knew what parvovirus B19 is. No, I don't see anything. Let's see. Anybody know what that was? Nope. Parvovirus B19 is Fitz disease. So that's the slap cheek syndrome where the kids wake up, big red face. They get a lacy rash, but the reason why it's here in respiratory is because the first signs and symptoms of parvovirus B19 or Fitz disease is cold symptoms. So most of these, even if they are not overt respiratory, most of them start out as cold symptoms. Mumps we can get, and mumps, remember, they get the big swollen face. It's all right here in airway, okay? There is an exception to this rule. Does anybody know what the exception is? It's something that you wouldn't normally think is respiratory. It would belong somewhere else. Does anyone know what that is? So remember, our exceptions are going to go in green here. The exception here is something called, this is scarlet fever, all right? And this one is weird. So people get super nervous when you say scarlet fever, okay? Scarlet fever, the only thing it means is it's strep throat with a rash. That's it. So they get strep throat, they get this rash all over them. It's not infected with strep. It's just a red sandpaper-like rash that some kids or some people will get when they get strep throat. Now, the reason people get all nervous about scarlet fever is because it killed a whole bunch of people back in the 1600s, 1700s, because we didn't know that it was strep throat. There wasn't any antibiotics readily available. So if you tell a parent of a child, your child has scarlet fever, be prepared, they're going to freak out, okay, and think there's something horribly wrong, all right? But scarlet fever just means strep of the rash. The reason I put it in green here is because, remember, all of our skin stuff goes in contact. So this is an exception to the rule. You will see stuff on their skin, but it actually goes in respiratory, all right? So our next one is going to be, oh wait, let's go to, in Droplet, we want to say what we have to wear. So what you have to wear for Droplet, the only thing you have to wear is a mask. And that is for you, that is for the nurse, okay? Even the patient doesn't have to wear one. This is the only thing you are required to wear for Droplet, and that freaks people out, and they think it's grody, because they're like, okay, if my patient has epiglottitis and flu, they're, you know, I'm not just going to wear a mask, but that's it. So I'm going to put an N for nurse if that's what you're supposed to wear, okay? So you guys will be wearing this, just a mask. Now, if you're coming within 3 feet of the patient, you're doing tons of patient care, you're suctioning and you're moving and you're cleaning out all these things, then you probably will add some PPE to that. If I'm going to be doing, you know, let's see, cleaning out the throat of someone with diphtheria, if I'm going to be, you know, doing some really extensive, like, up-in-your-face care, I'm going to wear something on my face. I'm probably going to wear a gown and gloves, but that is not required. All that is required is for you to wear a mask. Isn't that crazy and sort of feels a little gross, okay? But it's actually super true, okay? All right, so next. All right, so our next one is going to be airborne. Now, people have a hard time with airborne, all right? Airborne, our key word is rashes, okay? So our airborne precautions are going to be what we see on our skin and our rashes, which usually confuses people because they know that airborne is TB. And so they think that airborne is typically respiratory conditions, but it is not, okay? So the acronym for this one is CHAMPS, C-H-A-M-P-S. There's not as many disease processes in this one. So I want you guys to do your best and try to figure out the disease processes that go with CHAMPS. Now, I got a little creative on this one. So the A, don't stress yourself out about, because I'll tell you that one. The rest of them are pretty good as far as what you're going to see. So I want you guys to try to fill this out. You have like a minute to try to figure it out, okay? And then we're going to get started on it. So what we've done so far is to talk about contact droplet precautions. We are about to start airborne, all right? So contact precautions has the acronym, he is Superman. This is anything you'd find in wound, gut, or skin. There is one exception to contact because you would think it would be in respiratory, but they actually included it in contact precautions, and that's RSV. So any of my exceptions are going to be here in the green. So RSV is contact. I know I've said it 100 times, but I'm telling you, you will see it on exams, you will see it on NCLEX, you will see it in lots of places because it is an exception to the rule, all right? Required PPE for contact, we said was gown and gloves for the nurse only. Patient doesn't have to do anything special or different, okay? And then add PPE as needed for whatever task that you're doing, all right? Droplet precautions are anything you would find in respiratory in the throat, the whole respiratory system. So from here, right, as we breathe in air, goes through the mouth, throat, into the lungs. So anything respiratory is what you'll see. That's why you've got strep throat in here, you've got flu, you've got epiglottitis, you've got those kind of things. The exception to the rule was scarlet fever, right? So scarlet fever is strep throat, okay, with a rash. Since it's a rash, we would expect it to have been an airborne, but it is not. It isn't a respiratory because it is actually, excuse me, strep throat, okay? What is required for that is just a mask for the nurse, and that's it, all right? So the next thing we were going into was airborne precautions. All right, so airborne precautions, we use the acronym CHAMPS, okay? And airborne precautions are anything that we would see rashes, just straight rashes, okay? Up here we did creepy crawlies on the skin. These are our little bugs that like to crawl on the skin, like scabies and lice. Down here, this is anything that you would normally find as a true rash, okay? And so what's included in airborne here? The C is for chickenpox, right? So chickenpox is a rash. We're going to include it in airborne. This always totally weirds people out when we do chickenpox and rashes in airborne because it just doesn't seem to match up, okay? So the C is for chickenpox. The H is for herpes, all right? So if we have herpes, which we have herpes up here too, right? But these here, this herpes skin is something that's localized in one spot. So let's say we have something like a sort of herpetic kind of virus like shingles, okay? So shingles is part of the chickenpox virus, right? And so if we see those in one small area, like let's say shingles, we know that it typically does not cross midline or across it goes along the dermatomes and doesn't cross midline, right? So if we have it in one spot, let's say we have it right here on the abdomen, which is very common for patients to have it, and it's in one little spot, that's a contact precaution because we can cover it. That's how they prevent it from being spread. If you have a herpes infection or you have shingles, chickenpox, and it's everywhere, we call that disseminated. And if there's any rashes that are disseminated, then that's included in airborne precautions. So I want to be really clear about that. Creepy crawlies on the skin, disseminated or kind of everywhere rashes. So that's why you've got chickenpox, you've got herpes disseminated lesions, okay? The M is for measles, okay? 'Cause measles is an all-over rash, okay? Literally all for the A, I just put and. There is no A. There's like very few airborne diseases. So I put chickenpox, herpes, and. I know, I cheated, but it's the way that it goes. So measles is included here, and then Mycobacterium tuberculosis, which is our TB, okay? Now this is usually what people think of for airborne. So here we are, finally here. But this, even though it's an M, is actually going to be our exception to the rule. TB is a respiratory illness, therefore you would think it would go in droplets, but it doesn't. So I'm going to put TB here as my exception to the rule. Okay? All right, the P's. Anybody know what the P stands for? All right, so P I put for pox, and it's not just chicken, it's also smallpox. It's not just chicken, that sounded so weird. All right, so this is smallpox. Are going to go under airborne too. And then our S here, which I've already mentioned earlier, was shingles. All right? So, airborne is any rashes that you would see, chickenpox, herpes, measles. The exception to the rule is TB, which is also called Mycobacterium tuberculosis, smallpox, shingles. All right, now what is required for airborne, you typically want the patient, of course, to have a private room, right? Okay. We know that required PPE is an N95, okay? But the N95 is for the nurse to wear because this has to be specially fit. All right, the patient's not going to come in already being fit for that. So the nurse has to wear an N95. That's it. That's all you have to do for airborne. That's the only thing that's required. Now the patient typically will have private room, right? We do really highly recommend that. And we typically, especially for TB, are going to have a negative pressure room, all right? Now, if the patient is going outside of the room, like let's say you're transporting them to MRI, CT, X-ray, something like that, the patient just wears a normal, just a simple mask when they go out. They don't have to wear the N95. So we're going to wear the simple mask is just going to be for the patient, and that's only if we're doing transport, okay? So I'm going to put a P here for patient, all right? And that's it. This is super easy if you can remember your keywords and remember your exceptions, because exceptions are always going to be highly testable just because they're exceptions to the rule, right? So here we go. Let's just recap really quickly. Contact precautions, anything that you would find in the wound, inside your gut, creepy crawlers on the skin, all right? So here we have, what do we have in our wounds? We can get MRSA, right? We can get E. coli. We can get all these kind of grody bacteria inside of our wounds. Anything you'd find in the gut, so that's adenovirus in the gut, norovirus in the gut, rotavirus causes horrible diarrhea. We get salmonella, shigella, enterovirus, that all happens in our gut, okay? So these are the patients that have like the big giant blowouts. when they have big giant blowouts and they're on contact precautions and they have MRSA of the gut, or maybe they have, adenovirus, norovirus, something like that, you're probably going to want to put on more than gown and gloves. You're not required to, but for dear Lord's sake, please put on more. You do not want anybody's MRSA in your eyeball. You do not want any norovirus in your mouth. Like, just cover yourself, okay? So add PPE as necessary, all right? And then any creepy crawlies on the skin. Pediculosis, which is lice, right? Scabies, which are also creepy crawlies on the skin, all right? Exception is RSV, because you would think that would belong in a respiratory. So babies with RSV virus actually go in contact. Now, there are some hospitals that will add droplet precautions to it, okay, and they can do that. Like I said, it's always better to over PPE, but as far as requirements and exams, RSV is just contact, all right? Droplet precautions, respiratory, anything you're going to find in the respiratory system, all right? Even the ones that you wouldn't think are respiratory actually are, because they start out here, either mouth, throat, go into the respiratory system, or there's something that started out as cold-like symptoms, like parvovirus B19. Parvovirus B19, remember, is Fifth's disease. That's the slap cheek syndrome in kids. It starts out with cold symptoms, and the cold symptoms are how we transmit the disease. Remember, this is always a tricky one, and they love to test on this in pediatrics. Because parvovirus B19, once they break out in that slap cheek rash, they're no longer contagious, because it was contagious by droplet whenever they have the cold symptoms. So that's why we see that up there. Flu, diphtheria, epiglottitis. Flu is respiratory. Epiglottitis and diphtheria is throat stuff that's coming from the respiratory system. All right. Meningitis, mycoplasma pneumonia, all these respiratory viruses are going to be included in droplet. You're only required to wear a mask, and that's it, but add PPE as necessary. Our exception to the rule was scarlet fever. Scarlet fever is an exception because scarlet fever is strep throat with a rash. Since it's a rash, you would think it would belong down here, but it doesn't, because it's actually strep throat, and strep throat is here under droplets, okay? Airborne precautions. This is anything that has rashes, all right? So rashes on your skin, chickenpox, herpetic disseminated rashes, measles, smallpox, shingles. These are things that go everywhere. Now remember, shingles, if it's disseminated, that means everywhere, goes under airborne. If it's in one little spot, it's going to go up here under contact, okay? That's why I put kind of the herpetic sort of lesions up here. So one little spot, cover it with contact. Everywhere, I can't cover that, so that has to be airborne. Our exception to the rule was TB, because TB you would think would be respiratory. It's not, it's under airborne. The only thing required for you is an N95 mask. That's for you as the nurse, all right? We ask that they be in a private room, negative pressure room, patients going outside of the room to go to a procedure or somewhere else. They just wear a simple mask, and that's it, okay? So this is super easy. We have acronyms for everything, okay? So if you have any questions, I want you guys to go ahead and post that. But this is a super easy way to remember different precautions, all right? We're going to go ahead and loop the different videos together, and we'll make one video that we'll post on the Facebook, since we had the storm kind of broke up some of our sessions. But we'll be sure to put all that together. We are going to be doing a drawing for anybody that made any comments here on the video today. We're doing a drawing for our cute little short giveaway. All right. So we'll be giving away our Ivy League tutoring shirts. If you wear these on Tuesdays to your school and post a picture either on our Instagram or our Facebook, you get $5 off any of your sessions. Since we have some awesome Facebook Live sessions coming up, they're only $25. You get $5 off of that. I mean, hello. Okay, so come join us. All right. We will learn all the things. So be sure to check out our schedule. We have lots of other videos like this that are coming up. We have some 1-hour ones that are $25. We have some 2-hour ones that are bigger and more advanced. So we have something for everybody, and you definitely are going to learn, okay? So post any questions for us in the comments. We will answer any questions. We're going to take a picture of this board, and we will post that too, so that way you guys can have it for quick reference, all right? It was awesome being with y'all today. Thank you for being patient with the internet kind of connection issues. And we will see you guys. We're going to be doing another Facebook Live that's free next month on insulin, diabetes kind of thing. So mostly insulin, because that students really, really struggle with the different insulins and what do they need and when do you give them and what are you looking for. So that'll be our next free live, and that's next month. But you guys, we have tons of sessions. I mean, we have 20, 30 sessions a week that you could join in on and just start learning just like this. And keep in mind all of the really easy ways that we have to remember. All right. So it was a pleasure working with you guys today. If you have any questions, or if you want us to cover something that we haven't covered yet, a kind of topic that's been hard for you, you can either inbox us or you can write on the comments here. All right. And we will see you guys hopefully pretty soon. All right. Y'all have a good one.